and welcome. Today, we will be talking about addiction treatment levels of care. So, in addiction treatment, we really strive for a comprehensive approach. So, addiction treatment uses a combination of therapies and support systems to address the physical, psychological, and social aspects of addiction. We really focus on client centered care. So, treatment is tailored to each individual to address their unique needs and circumstances. And the goal is sustained recovery. So, the ultimate goal is to help individuals achieve and maintain long term recovery, improving quality of life and community and reintegration. So, when we talk about the levels of care, it's really important to understand that addiction treatment offers tiered levels of care, each tailored to individual needs and support necessity. This flexible system allows for transitions to different levels as recovery progresses. And I'll go over that in just a second. So, we're going to watch this video on levels of addiction treatment and care so you can gain a deeper understanding of what there is out there.
Hi guys, my name is Alex Sabrina with Addiction Helpline America. Addiction Helpline America is an easy to use and navigate online directory for addiction treatment resources. It helps you find addiction treatment resources all across the country in all 50 states. If you or a loved one are looking for any resources, please visit addictionhelplineamerica.com, scroll through the site, pick your state, and find all the resources near you. Today we're going to talk about the different levels of care that are offered through addiction treatment services. These levels of care include detox, inpatient residential treatment, partial hospitalization programs, also known as PHP, intensive outpatient programs, also known as IOP, as well as regular outpatient. We're going to go through all of these, talk about some of the benefits, talk about the differences, and help you figure out what level of care might be best suited for you and your needs. So let's get into it. The first level of care we're going to talk about is the most common, and it is called detoxification. I'm sure you've all heard it before. Detox. Detox is usually the first step in the addiction treatment process because it's so important to get all those toxins out of your body. The detox process typically lasts about 7 to 10 days, but could last a little bit longer depending on certain people's circumstances. The detoxification process typically happens in a hospital-like setting where you have 24-hour care from nurses and doctors who are able to help you manage your withdrawal symptoms. This can be difficult to manage on your own, so it's great to do it in a hospital setting with medical staff that's there and trained and prepared for these withdrawal symptoms to happen, and they know how to make you feel better. Depending on what you're using, there are a wide range of withdrawal symptoms that vary from nausea, muscle spasms, diarrhea, vomiting, muscle pains, muscle aches, weakness, fever, hallucinations, agitation, depression, anxiety, insomnia, inability to eat, inability to hold food down. Depending on how severe your addiction is, your withdrawals are going to vary. While you're there, you're going to be able to get medication, medical attention, and therapeutic needs met. While we're talking about the detox setting, I just wanted to show you guys a detox. This is Future Now Detox. And I know we keep saying a hospital setting, but as you can see, it's a lot more comfy than that. Place to lounge, watch TV, sleep, eat, rest, and get better. So just want to show you guys what a detox looks like. Towards the end of the detox, you'll talk to your case manager or your therapist about the next step that's best for you. So you've finished detox, and now you have to figure out what is next. The next level of cares that we're going to break down for you are going to be residential or inpatient treatment, PHP, also known as partial hospitalization programs, IOP, also known as intensive outpatient programs, and OP, which is an outpatient program. So, residential treatment is basically a 24-hour, well-structured level of care where you reside, where you seek treatment. So, you are not going home at the end of the day. You are staying in this facility. You are living there. You are eating there. You are playing games there. So, like I showed you guys a detox, I wanted to show you what an inpatient residential treatment facility looks like. This is a place in Colorado. It's 64,000 square feet, and basically every single thing that you need is inside of it. So, I know kind of you think, oh, I'm in a facility 24 hours a day. I feel like that would be really uncomfortable. But as you see, they have an on site pharmacist, they have all different group rooms for different activities, therapists, places to eat, places to hang out outside. You'll have your own living quarters. places to do your laundry, places to get your hair cut. They usually have little workout areas and gyms inside these residential treatment facilities. So I just thought it was a really good example to show you guys of, maybe you won't expect something exactly like this, but they're all pretty similar. You see this girl putting her stuff away, they're hanging out with little doggo throughout the day. I just thought it was really great because this really does show a good example of what an inpatient residential treatment facility could look like. Residential treatment is the highest level of care possible after detox. Throughout the day, you'll have a ton of groups. There are different kinds of residential treatment. So short-term residential treatment is usually about 1 to 6 weeks. Long-term can be all the way up to a year. There are also things called therapeutic communities. The therapeutic community is super cool. The clients and the providers, like the therapists, they all live together on the same compound. So it's 24-hour care, it's structured care, and it's also long-term. And many of these therapeutic communities are focused on co-occurring disorders like addiction and depression, or addiction and anxiety, or eating disorders, etc. While residential treatment facilities are awesome and the care that you get there is consistent and structured, some people can't go to residential treatment programs, so they'll opt for a lower level of care. Sometimes even your provider will suggest a lower level of care if they think it's best for you. So now we've gone detox, residential inpatient treatment. Right below that is PHP, also known as partial hospitalization programs. When you are in a PHP program, you are spending 20 hours a week in a facility. Being that PHP is a lower level of care, you do not actually have to live in the facility 24 hours a day. You can possibly live in a sober living house, or you can even live in your own house. And basically, you're going to go to attend this program 20 hours a week. The therapy is very similar to inpatient. It's just not the 24-hour care aspect. When you do go home, you are on your own. But this also allows some perks and benefits. The benefits of PHP programs are really the freedom. This might be good for somebody who has a child at home or has a job, because you're able to continue your life while still attending a treatment program. You're going to do different groups like 12-step programs, process groups, art therapy, relapse prevention, stress management, anger management groups, and more. A person will usually stay in a PHP program for about 30 days, or until your provider feels that you are ready to step down to the next level of care. Next level of care down would be IOP. IOP is intensive outpatient. Basically, what intensive outpatient is, it's a step down from PHP. So PHP, you're there 20 hours a week. IOP, you are at the facility for 9 hours a week, going to therapy, doing groups, doing process groups, anger management, all that good stuff. Just like PHP and IOP, you are not living at the facility. You are either living at home or a sober living environment. Again, this could work really well for someone who has a job, has kids, or for some reason cannot go to a residential treatment program for a week or a month or 6 months. So these are definitely lower levels of care that work and are effective for the right client. And all of these levels of care include drug testing, which is so important. After you're done with IOP, which you could be in for 3 months or longer, you drop down to OP. And what is OP? OP is just regular old outpatient. So now instead of going 3 times a week for 9 hours, you might go 1 time a week for 3 hours. And it's really nice to have these levels drop like this because you can continue to get the care that you need. When you're at PHP, you might get to a point in your recovery where you don't need to go to a treatment facility 20 hours a week. That is the hope after all. So after you have gone down the entire spectrum of treatment levels from detox to residential to PHP, IOP, and OP, what's next? You can continue at an outpatient level of care usually for a pretty long time. It's only 1 time a week. This can even be lowered to every other week and once a month, depending how far along you get in your outpatient process. You can usually stay in outpatient for a good amount of time, but also you're just checking into a facility and you're living at home and you are working or going to school or raising your family or whatever it is that you do. At the end of the day, guys, there's no one size fits all in recovery. That's why it's so important to know all the different levels of care that are available to you. Some of you might feel that a therapeutic community will be the most effective for you and your personality. Others might feel that for their circumstances, they prefer an IOP level of care. Remember, detox, hospital setting, 7 to 10 days. Residential, total inpatient setting, and this can last 30 days typically, but could last up to 3 months, 6 months, or a year, depending if it's short or long-term residential program. You have therapeutic communities, which usually are long-term as well. Below that, you have PHP or partial hospitalization programs, which are 20 hours a week at a rehab facility. The rest of the time, you're either living at home or in a sober living house. Below that is IOP or intensive outpatient programs, and that is 9 hours a week at a treatment facility, and the rest of the time you are living at home or in a sober living environment. After that, you have OP, which is just once a week for 3 hours. You go see your therapist. Our website, Addiction Help.
Okay, so that video was very educational. There was a lot to learn. I'm just going to talk a little bit about what was gone over in the video. So, detox or withdrawal management, as she said, is a safe, supportive care for substance withdrawal symptoms. Normally, it's medical, but there are non-medical ones. There's one in Reading. Residential treatment is 24/7 care in a structured treatment environment. So people are actually in the building, live there. Partial hospitalizations programs, which is a daily treatment, 6 hours a day without overnight stays. Normally there's an hour lunch, so 5 days a week would be around 20 to 25 hours, depending on the program. Intensive outpatient programs, attend group 3 times per week for 3 hours. And this is really allows for people to transition into like a work life balance and still get treatment. And then outpatient is normally like once a week, and it could be addiction treatment services, therapy, or different resources in the community. I want to talk about medication assisted treatment. This is also part of the continuum of care. So it combines medication with counseling for opioid addiction and other addictions. So people actually will go, some people go every day to get their medication, and then you can work your way up to going less days. Sober living environments or recovery houses. These are structured substance-free living environments that provide support and accountability. So normally there's a house manager that it depends on the sober living environment, but many of them have a house manager and people get urine tested, and they also have to follow rules like you have to clean certain parts of the house certain days or have a curfew, but it really offers for a little bit more structure before transitioning into independent living. The other thing I wanted to talk about was treatment courts. So, treatment courts are diversion from incarceration, and they combine judicial supervision with treatment services. So, you might see these in your behavioral health or with different mental health agencies also. But these are a really good um, substitute for incarceration, and people can get treatment while they're doing it. So I just want to talk about the types of therapy that we also see in the addiction world. So there's individual therapy, providing one-on-one support and guidance to address underlying issues and develop coping skills. Really, I've seen a lot of good outcomes with EMDR, eye movement, desensitization, and reprocessing. I've also seen really good outcomes with DBT, which is dialectical behavioral therapy. There are other ones that are really good out there, but those really look at trauma and daily routines. Group therapy, a lot of group therapy is held in addiction treatment centers. So it's a really big focus on peer support, shared experiences, and learning from others in recovery. And then we have family therapy. So to address the impact of addiction on family dynamics and provide strategies for healthy communication and support, because addiction really is a family disease. So it's really important to address relationships inside of families, not just the individual that's in addiction. I want to talk about 12-step programs really quick. So, uh, the core principles of 12-step programs are they treat addiction as a disease, they have a spiritual approach, they really, really talk about self-reflection and honesty. Their structure and support is that they have regular group meetings, and in these meetings, people learn coping skills and share their story. Also, there are mentors who provide guidance. So if you've heard people talk about their sponsors or working the 12 steps, Those are all parts of it. Um, the benefits and accessibility. So it's widely available and often free. There's a structured recovery plan. Those are the 12 steps, right? And community support. So your sponsors, and a lot of times there's a lot of community events. So alternative approaches, some people find themselves not wanting to do AANA. Spiritual focus may not be for everybody. So smart recovery uses cognitive behavioral therapy and self-help. So that's something to think about. So bridging the gap. So treatment in rural communities. This rural communities present unique barriers to accessing addiction treatment. And so limited resources, stigma, and isolation make it challenging to find and maintain support. I want to talk about some digital and virtual resources and how they're expanding accessibility to treatment. So there are telehealth platforms that connect clients instantly to addiction counselors. Mobile units could facilitate or teach about virtual sessions. And so this would be able to bring expert care to remote locations. There are support apps. So there are apps for managing cravings and developing coping skills. These digital tools could provide 24/7 support between interventions. And then there's virtual groups. So there's online peer support communities. This fosters connection and reduces isolation. So here are some different apps. So we have Sober Grid, which is a global sober community for peer support. They can help you find recovery meetings via GPS. We Connect is a daily recovery reminder, progress tracking, and accountability. You can find accountability partners. So that's a way to track your sobriety, look for support, and find people to support you. Quit That, this tracks and manages quitting substances or behavior. And then Helpline America is what that video was on that we talked or that I showed. And it's a 24/7 helpline that connects callers with information on treatment. So local resources, I didn't find a whole lot of local resources around Siskiyou County. But what I did find for withdrawal management, Empire Recovery Center, but this is a non-medical withdrawal management, which means there's no doctors on site. So it's a little bit, the symptoms people will experience would be a little bit more intense than if you are in a medically managed withdrawal management program. Residential treatment, I found Empire Recovery Center in Reading, Visions of the Cross in Reading, and Newport Academy in Reading. And the Newport Academy is ages 12 to 17, so that would be beneficial for your adolescents. The partial hospitalization programs, it looks like Shasta County Mental Health in Reading offers it. Evolve Treatment Centers offers it in Reading for adolescents, and Newport Academy in Reading offers it. And they also have an online program for adolescents. Intensive outpatient programs. So Bright Heart, which is part of Shasta County Mental Health. Sorry, I think it's actually Siskiyou County Behavioral Health. They offer an outpatient program. Siskiyou County Behavioral Health does. And the Currach Tribal Health and Human Services also offers intensive outpatient. And then if you're looking for medication-assisted treatment, Siskiyou County Behavioral Health, Currach Tribal Health and Human Services, and Mount Shasta Community Clinic. Mount Shasta Community Clinic is the one that has the Bright Heart Health. So when we talk about the skill to go over today, I'm gonna show you a warm handoff framework as we were talking about levels of care. So the purpose of this is to ensure seamless transitions between the mobile crisis unit and appropriate levels of care, reducing gaps that might lead to disengagement or relapse. Excuse me. So we're going to use an assessment that we talked about earlier. It's called the CAGE. Remember the CAGE? And this is the CAGE aid. And the CAGE aid is the CAGE questions adapted to include drugs. So the first question is cut down, right? For the C. Have you ever felt you should cut down on your drinking or drug use? Annoyed, the A. Have people annoyed you by criticizing your drinking or drug use? Guilty, which is the G. Have you ever felt bad or guilty about your drinking or drug use? And then the I opener is the E. Have you ever had a drink or use drugs first thing in the morning to steady your nerves or get rid of a hangover? So for each yes answer, it's 1 point. So 2 points or less, low severity, refer to IOP. 3 points or more, high severity, refer to behavioral health or inpatient care for further assessment. So once we conduct this assessment, then we want to move into immediate rapport building. So build trust to encourage follow through with the referral. So the skill would be employing motivational interviewing techniques, which is what we talked about in the training before this one. So explore the individual's ambivalence towards treatment, highlight the benefits of the recommended level of care, and reinforce the individual's strengths and desires for recovery. So something you might say is, what's most important to you right now as you think about next steps? How do you see this care supporting your goals? Right? Remember, we find the discrepancy and then we help explore what are their motivations, and then we kind of braid those together to help with the ambivalence towards going. So then we want to do a clearer explanation of the treatment pathway. So the skill would be to use analogies to explain the continuum of care. It's like a staircase. Each step supports you differently. And then you talk about what to expect at the recommended level of care. For example, a detox or withdrawal management referral would be, this will be a safe, medically supported place to help your body adjust without the substances. After that, we'll move to counseling to build long-term goals and skills. Active connection to the next level of care. So this is the next step. Ensure the individual reaches the recommended service without losing momentum. So the skill is to execute a real-time referral process by calling the receiving facility with the individual present, scheduling the first appointment, and securing transportation if needed. So let's just talk about how this might work. So we're going to talk about Jason. The mobile crisis unit is called to assist Jason, a 32-year-old man experiencing severe withdrawal symptoms from alcohol. Jason has a history of multiple failed treatment attempts and expresses distrust of healthcare providers, stating, "I've tried rehab before and it's a waste of time." His mother, Angela, is present and pleads for help, saying he's going to die if he doesn't get real help. The crisis team's goal is to transition Jason safely to withdrawal management and lay the groundwork for a long-term recovery by building trust and minimizing gaps in care. All right, so how would we do this? We're going to use the warm handoff framework. So first we would do an assessment and identify the appropriate level of care. So the team conducts a brief assessment using the KJADE tool. Jason scores a 3, indicating high severity and the need for inpatient care. The team member might say, "Jason, your symptoms suggest that inpatient withdrawal management is the best option to keep you safe and begin recovery. Would it be okay if I explain what that involves?" So the outcome, Jason reluctantly agrees to hear more about the recommended level of care. Step 2 would be immediate rapport building. So the team employs motivational interviewing to explore Jason's hesitancy and focus on his goals. So you've had tough experiences with treatment before. What's most important to you if you're going to give this another shot? Jason might say, "I just don't want to feel judged or like I'm wasting my time again." The team member might say, "That's completely understandable. Let's find a program that treats you with respect and focus on what matters to you." So the team member here is really validating what he said and then trying to bridge the gap of the ambivalence to find a level of care that works for him. So Jason starts to engage, expressing cautious but some openness to treatment. So the next step is to clearly explain the treatment pathway. So the team's action might be, the team uses an analogy to simplify the continuum of care. So the team member might say, "Think of this as a staircase. The first step is a safe environment to help your body adjust to being alcohol-free. From there, we'll move to counseling and to build skills and work on your goals." So here's an example for detox referral. This will be a medically supported space where you'll be monitored 24/7. They'll help with the physical symptoms while keeping you as comfortable as possible. The outcome is Jason nods and says, "That doesn't sound as bad as I thought." Step 4, active connection to the next level of care. Here's the team action. The team calls the receiving facility with Jason present to confirm bed availability. The team member on the phone, "I have Jason with me and we're looking to bring him in for withdrawal management. Can you confirm his intake time and any preparation needed?" Team member to Jason, "They're expecting you in 2 hours. Let's arrange transportation to get you there safely." Outcome, Jason agrees to go and the team arranges a ride with Angela accompanying him. Step 5, ensuring follow through and emotional support. The team helps Angela prepare to support Jason's recovery. The team member, Angela, "Jason may feel overwhelmed when he gets there. It's important to encourage him to stay and remind him of how much you care." Team member to Jason, "You're taking a big step and that's not easy. Remember, this is about you getting a fresh start. We're here to support you." So here's the outcome, the hoped for outcome. Jason transitions successfully to withdrawal management with minimal resistance. The warm handoff fosters trust and reduces the likelihood of disengagement, setting Jason on a path towards recovery. So the resources that we used in this scenario aren't very prevalent in Siskiyou County. I couldn't find a non-medical assist, or I couldn't find a medically assisted withdrawal or medically assisted detox. I think the closest one is probably Sacramento. There was one up in Medford, Oregon, if people are willing to go over the border, but imagining access to those places might be really difficult. So in a situation like this, reporting them to medically assisted treatment, medication assisted treatment like Suboxone or Vivitrol, trying to get them involved with behavioral health might be really helpful. And making those steps towards doing that would probably make a really big difference in their life. So debrief discussion. How did the team use rapport building techniques to engage Jason? By validating his concerns and focusing on his goals rather than imposing treatment, right? So we focused on what he was concerned about, and then we explored what treatment might look like for him. So what strategies ensured Jason's smooth transition to care? Clear expectations, active involvement in the referral process, and emotional support for both Jason and Angela. Why is the warm handoff important in addiction treatment? Well, it minimizes gaps in care, reduces client anxiety, and increases the likelihood of successful engagement in treatment. Key takeaways. Warm handoff framework aligns different levels of care, ensures smooth transitions, and reduces the likelihood of clients dropping out of treatment. Levels of care. Clients may move through many levels of care. Digital solutions, telehealth platforms, recovery apps, and virtual support groups are important, especially in rural communities. And types of therapy, individual, group, and family therapies, 12-step programs, and alternatives like Smart Recovery. All right. Thank you. I hope this was helpful.